Okay. Hi. Good morning, everyone. Anyone who's out there. I'm Dr. Michael Mosley, and welcome to the Independence Age. Thank you so much for joining us for what is our first and really most dramatic, in a way, public event of the Independence Age. This is a hugely ambitious project with the technology, but we're all up for it and thoroughly looking forward to it. Now, I'm joined by Sir David King, who prefers to be known as Dave, and he's the former Chief Scientific Advisor to the British government. And he's formed this committee of 12 scientists to offer open and transparent advice on their assessment of the scientific evidence on COVID-19. Now, today, the question that everyone is asking is it safe for schools to reopen on June the 1st? The government says it is, but Independence Age has just published a draft consultation report this morning that says it's not. But Independence Age, we're going to be hearing from the scientists shortly, but to explain, this event has been organized so the scientists can hear directly from you. We want to hear from you, the public. We want to hear the public's views and concerns to feed into the final report, which will be presented to the government next week. And so that's why we're here. And we're delighted to be joined in holding this event with the British Medical Association and Mumsnet. Welcome to you both. And helping feed in your views from our social media channels and questions from the public is Samira Ahmed. You're there, Samira? Sorry. Right, welcome, Samira. Now I'm going to hand over to Sir David King, to Dave, who's going to tell you a little bit about the report before handing over to questions from parents, teachers, union representatives, and as many people as we can fit into an hour. So over to you, Sir David.
Thank you very much, Michael. In focusing down on one subject, we have understood, of course, that schools reopening is a critical factor in moving forward out of COVID-19 epidemic. Schools play a critical role in the development of children's emotional, social, and intellectual capabilities. But of course, it's important to acknowledge that schools are also embedded within communities, the adult staff, the parents, but also the local community. And on this basis, we have examined this question: should schools reopen on the 1st of June? Now, of course, schools are a major axis of local communities, and we strongly and first of all recommend that decisions on school reopening are made at the local level, involving all local stakeholders. Our recommendations are based on existing evidence, but also on new modelling. We considered that there were two major requirements for school reopening. The first is that this reopening should be based on evidence of low COVID-19 infections in the local community and the ability to respond rapidly to new infections through a test, track, and isolate strategy. Currently, regrettably, there's no evidence that these conditions are met, and it's therefore not safe, we have to emphasize, to open until they are met. Now, we've used advanced mathematical techniques to estimate how likely it is that children will get sick depending on when the school reopens. Delaying by 2 weeks halves the rate of infection. Delaying to September brings down the infection probability to a much lower number. Now, I'm just going to turn to Christina Pagel and maybe Carl to comment on this, and then I'll come back and finish my introduction. Christina?
Hi. So, yeah, Professor Carl Friston's group at University College London use a form of mathematics called dynamic causal modelling. And they normally use it for their neuroscience research, but they've adapted it to model the spread of COVID-19 in the population over time. And so for this report, what they did is they used the most recent information that we have on national levels of COVID infection in the UK and what we know about COVID-19 and its spread to look at the chances of a child being exposed to someone with the virus, getting infected, and dying for different dates of schools reopening. So those dates are the 1st of June, the 15th of June, and the 1st of September. the chances of infection are very low, but they're not zero. So if schools reopen on the 1st of June, you'd expect about 1 to 2 children per 100 to be infected. And that drops to less than a child in 100 if you wait until the 15th of June. The chances of death are tiny across the board, around the same level as a road traffic accident. That's national data, so there is local variation, and that's why we said that's really important. So different places will have different levels of current infection, and also differences in how ready schools are to reopen safely. And so what we're really saying is that where infections are still quite high, or where the structures aren't in place to enable opening safely, so a test, trace and isolate system, delaying by just 2 weeks reduces that risk by half, but also gives time to put those systems in place to then have a safe reopening.
Thank you, Christina. Carl, do you want to add anything to that?
No, that was a perfect summary. Thank you.
Thank you. So what we want to emphasize is, of course, it is important for children to return to school. Vulnerable households, it's particularly important for them. And we therefore also raise the possibility of using a wide range of currently empty facilities, private schools, sports facilities such as football and rugby stadiums, during both the summer term and also over the summer holidays. And I stress that these are facilities that are currently disused. Well, I want to now simply thank my colleagues on this Independent Sage group. Their efforts in exactly 1 week in preparing a report and having meetings have been simply astonishing. The amount of time they've put in, and remember that all of them have critically important day jobs dealing with this pandemic. So I really give a lot of credit to them for this remarkable piece of work. And I think you'll understand the reason they're putting their time in is because they understand the severity of the issue that we're talking about. So I'm now going to pass you back to for the Q&A to Michael.
Thank you. Thank you very much. And I'm hoping that we have Kavita Baldwin. Do we have Kavita Baldwin? I say,
Hello.
looking. Hi, can you introduce yourself briefly? You're on.
Hi, Michael. Yes, my name's Kavita Baldwin. I'm from Nottingham.
Great. And can you, what is your sort of question? What would you like to know?
So as a parent of 2 children in year 1, I've been struck by 3 bits of evidence. The first is that it seems that children are as likely to get infected as adults. The second is that the risk of exposure to primary school or early years teachers appears to be greater than that of secondary school teachers. And thirdly, that the viral load appears to be as high in asymptomatic people as it is in symptomatic. So as a parent, I'm struggling to understand how that sort of evidence seems to be less important than the results that come out of modelling. So I guess my question is, why is the modelling preeminent in this debate?
Right. David, would you like to address that one?
Well, I think the first thing I want to say is that, of course, the contact that children make with their adult teachers, the contact they make back home with parents and grandparents, that is what subsequently may cause a spread. And so this question is critically important. But modeling also gives us an ability to respond to this. I wonder who would like to pick it up. Have I got any colleagues willing? Yeah, Christina.
So thanks for the question. Basically, things like how likely children are to get infected and how likely they are to be infectious does go into the modelling, so it is included. In terms of risk to teachers, that's something that we want to look at over the next week. I think it is really important to try and consider what are the risks to adult school staff. I don't think it's that modelling is more important, it's that it just provides an extra dimension to help make those decisions.
Kamlesh, could you?
Yeah. Remember, the data that go into the modeling are evolving all the time. We don't have huge amount of data. A paper has just been published today showing that there is a low susceptibility of COVID infection in children aged less than 18 compared to adults. But there is very little evidence in terms of transmission at population level from children to adults. Also, there is some data showing that about 40% of people may be symptomatic when they're transmitting the disease as well. So lots of unknowns when what they go into the model as well. But this is a rapidly evolving area.
Right. Thank you very much. Thank you for those answers. I hope that's answered it to some degree, Kavita. We're moving on now. Fiona Miller. Do I have Fiona Miller here?
Yeah, I'm here. Hello, hi there. So I'm coming at this really as a school governor, who, like many other governors around the country, we're knee deep in health and safety reports at the moment that we have to sign off. And I'm quite confident that since the government guidance says from June the 1st, and schools have never closed, that there will be a trickle back to school in the summer term of some pupils. My concern is really what happens in September, because we don't know what will be happening with the virus by then. And I want to know what the science can tell us about balancing the immediate risks to young people, children and their teachers against the long-term risks to those children who won't be in school and who may not just be disadvantaged in educational terms, but socially, emotionally, and possibly in danger. Because one of the things that we are hearing as governors is that schools are finding it very hard to fulfill some of their safeguarding responsibilities, understandably, especially if they can't make contact with families.
Right. David, do you want to take that one on?
Very quickly, let me say, this is why we're stressing community-based responses and getting local stakeholder views. It is very clear that in deprived communities, this is the biggest problem of all. Children who are not able to go to school, but also when they go back to school, is it going to be more effective for the local community? So there are two challenging problems for us here. I don't see a hand up from one of my colleagues, please. Zubaida.
The other thing, Fiona, that we thought about, sorry, can you hear me?
Okay.
The other thing that we thought about is it's not just about the infection. It is also, as you rightly pointed out, about the educational gaps and the welfare of those children that are not going into school. Now, right now, the government is focusing on just 3-year groups going to school. So the big question is what about all those that are not going to school? And those especially who don't go to school over the summer period and who may not even start in September. Now, one of the things that we talked quite a lot about is just because there are some kids going back to school, first of all, we can't assume that they will get the educational level that they're used to, because teachers are now also going to be responsible for their safety and keeping them apart and all those social distancing measures that are required. And secondly, we need to improve the provision for children, the emotional, pastoral and educational provision for children outside of schools. And so far, the government haven't been very strong on that. I don't think it's an overstatement to say it's been a little bit disappointing, starting from the provision of free school meals. And we have discussed how it's quite important that that provision outside of schools, no matter what, even if there are increasing more year groups going back to school, significantly strengthens.
Thank you. I hope, Fiona, that answered your question. Can we move on to Samira now? Samira, what have you been hearing?
Hi. So lots of questions and some very specific. So I'll start with this one, which is from Sheila Trasler in East Lothian. She's a type 1 diabetic. Her children, who are 12 and 17, are really worried. They have normal health, but they're really worried about her getting sick if they bring it home from school. So her question is, how safe is it for children who have a parent with type 1 diabetes to return to school, knowing that they may bring the virus back home and that type 1 diabetics are more likely to die from the virus should they catch it?
Right. David, the question is, there are certain groups who are obviously more vulnerable, and type 1 diabetics are high on that list. So the question is, what do we do about that?
Right, and it's quite a long list, of course, over 75s, etc. I'm going to go to Kamlesh for an answer.
Yes, so this is a really, really important question. We're getting this on Twitter all the time. Fortunately, we have the best data in the UK, and we just published a study of 3.5 million people with diabetes yesterday. and there are risks, but the risks for people aged under 40 are extremely low. There were no deaths in people aged under 20 in terms of the adults, but even those under 40, it's extremely low. The kind of
46, so there is a concern.
Yes, so the risk goes up slightly, but the greatest risk are in people aged over 70, both for type 1 and type 2 diabetes, and much, much greater at the age of 80. There's a fourfold increased risk for both. So the risks overall are lower, but there is this balance between risks and educational attainment of the children. There are other things, if you have diabetes, that you need to be monitoring in terms of having tight glycemic control is important. That was shown to be a risk factor as well. Being from ethnic minority groups, being obese, these are all factors that are associated with increased risk if you have type 1 or type 2 diabetes. And this is where it's a personal judgment in terms of the parent and the child, whether one needs to take that risk. And it all depends, I think, and we'll say this all over again. You need your local intelligence. What is the infection rate in that community of the population that the children are going to school with? Some areas, deprived areas, inner city areas will have much higher rates compared to other areas. And so it's very, very important that you have local intelligence on infection rates.
Presumably we don't have any data on the risk specifically of children passing it on to adults who are more vulnerable.
No, so the systematic review just came out today. That doesn't give us much evidence in terms of transmission rates at population level.
Right. So your advice is basically you have to look at what the rates are and make your own judgment, which is obviously a very difficult thing to do.
I have plenty more questions if you need, Michael.
Yes, let's have another one. Let's hear another question.
Okay, so this is from Jill Green in Oxfordshire. She wants to, it's more sort of drawing attention to the urgent situation, she says, of the lack of staff medical PPE to protect vulnerable children in special needs schools. There are 1,033 of them with over 1 million pupils in England alone. She feels that these children's safety has been totally ignored by the government regarding a medical PPE for school staff. They need, students have so many severe problems such as paralysis, epilepsy, conditions that could lead to self-harm. Some children need to be tube fed. There are children of all ages who are incontinent, often requiring assistance from 2 members of staff. So staff members, including she has a teacher daughter, she feels are completely unable to distance themselves in order to care for them. Many of these children have tragically short-lived lives anyway, and the danger of COVID-19 passed on unknowingly by unprotected staff, she's concerned could be fatal for them. Wonders what the government is doing for them and what are the panel's thoughts about special needs children.
Anyone want to take that one on? Any hands up? Okay, Alison. I think Alison has said yes. Are you on, Alison? Alison Pollock.
Yeah, I think you need to turn your visual off.
The joys of technology. David, do you want to take that one? You were waving your hand, and when Alison is back, I'll try and get hold of her.
Well, I think this one is too difficult for me.
Can you hear me?
We can hear you, but we can't see you.
Go for it, Alison.
That's all right. A really very important issue. And this is all about what's happening in institutions, whether it be schools or nursing homes or special institutions for particularly vulnerable groups of children. And one of the big issues that we've come up against is this whole issue of the staffing levels and the ratio of staff to students, but also staff to the residents of places. And I think this is an issue that the government really needs to look at properly, because staffing levels are as crucial to public health and outbreak control as all the other measures that we put in place. So there is no doubt, there's good research that shows the higher levels of staffing, the more qualified staffing, more trained staff you can put in, the better outcomes for everybody and the better quality of care. And if and you're talking particularly about a very vulnerable group where you are going to need much higher levels of staffing, and probably staff and training up from other areas. But that is going to be no different from schools, where in order to get children back to school safely, we're going to have to see major reductions in class size, which is on average between 35 and 40, to get them down to 15. So this is about a major investment in children and in the vulnerable communities where you rely on staff and qualified staff. I hope that answers your question.
Thank you. I'd like to go to Wayne Bates now. Wayne, are you there? I can see your symbol, but yes, just coming on.
Yes.
Wayne, if you could introduce yourself as well.
Certainly, I'm Wayne Bates. I'm a national official with responsibility for health and safety for NASUWT Teachers Union, and clearly we have lots of questions that we've been posting to the government regularly that haven't really been answered. And one that I think is key that we've been asking repeatedly but haven't had a response to is, what is the modelling of the impact on the R number of reopening schools, and what are the assumptions that underpin the modelling, and are the assumptions that are being applied reasonable?
Okay, who would like to take that one on?
So first of all, let me just respond by saying, really, this should be done at a local level. If we just take a national level, we're going to miss an awful lot of information. Is anyone amongst the experts like to put a hand up for me? Yes, I've got Christina.
So just to say, in terms of the government decision making, we haven't got access to the scientific evidence that they're using any more than anyone else, but they are, I think, publishing it today. So we should be able to see today what they're modelling and what they're modelling on the impact of our number. But I mean, I personally don't know what they've used.
Deenan?
Yes, hi Wayne. It's an important point, and I think critical is, as we hope overall infections in the country is coming down, then as Dave has said, it's going to be a real local issue as to the impact of school opening. And what we've argued in our initial consultation document is, in fact, that there needs to be the ability to, in real time, capture those data, which then, that is then the data that the base of then being able to ask, what is the impact over time of the risk of school, rather than an R0 value, which of course is normalized over the whole country and may indeed miss specific outbreaks that are undertaken. So I would only suggest that becomes the focus of school opening as well, is the degree to which we can access and initiate that access to data locally. Thanks.
Is there any evidence of the time scale on which that could happen, that might happen? How soon could we see that?
Carl, do you want to take that one?
In terms of the modelling, I think the modelling is moving in this sort of more fine-grained direction in order to accommodate more local data. So I just want to reiterate to Dave, and in fact, the notion that this has to be a community-based response. It has to be, dealing with the situation in your area with your community. And as those data become available, and they're not really as accessible as people would want at the moment. So I think that is quite a pressing issue. So if I could turn some knobs and make those data available, I would certainly be pressing people to turn those knobs right now. The modelling is there. To reiterate Dean's point, what we need is data assimilation. So this is not retrospectively quantifying how good we have done in suppressing the reproduction rate. We actually want to know, what's the level of infection in my area? How likely is it that my child is going to be exposed to contagion if he or she goes back to school? Those models are being developed. The insights afforded, I think, are quite interesting. The second wave and the rebound from the modelling that's been done so far is probably not going to be a function of social distancing so much, or decisions of the sort, should I send my children back to school? They're going to be much more driven by the long-term second wave in several months' time. And that's going to be, I think, the big consideration that affects our policy decisions and our health management and our responsibilities, you know, as teachers and the like. And that in turn brings us to testing and tracking and tracing, because that's the thing that's going to make a difference. I just also wanted to make the point that the modelling suggests the big issues now are how you deal with surveillance at a community level, at a primary health level, in the service of keeping the infections in the long term manageable to defer a second wave.
So you're suggesting it is possible that we could have local results. So for London or an area of London, you might be able to know your R number. And for the previous caller who was asking, for example, she has type 1 diabetes rather, which makes her more vulnerable. So if she can go and look at her local news and see the R number is really low, she can be reassured. If the R number is high, then maybe she's less reassured and maybe more anxious about sending her child to school until it goes down. You could imagine that happening?
I think that's going to be imperative. I mean, everybody's been talking about risk, and you know, it's going to be up to the parent, to the, you know, up to the teacher, and to a certain extent the child. You know, what risk am I going to tolerate? But to quantify that risk, we need to actually have numbers on it. I think that's the key role of the modelling, but it's only going to be useful modelling if it's about you and your risk, which brings us right back to the local data and the importance of making those data available and assimilated in a way that people have direct access to. So it is certainly possible that one could actually have apps or websites or perhaps a call center to your local university that will evaluate for you what the probabilities of this or that. That would be lovely.
Okay, so ideally something almost like a local weather forecast,
yeah,
where you'd see what's happening in your area.
That's a perfect analogy, yeah.
Samira, any other questions coming in?
Absolutely. And what's really interesting is how many of them are around this issue of parents and teachers feeling that they're being asked to assess risks when they kind of want to know it's safe to go back. So I'm going to combine two questions. One is from Suzanne Ferguson, who's raising the issue of multi-generational households. My primary school age child and I live with my 80-year-old mum. How safe is it for the elderly in multi-generational households with schools reopening? I'm going to add on another question from Rebecca Lewis, but many more people are tweeting it in as well. Do you think it's wise for me to send my year 6 child with mild asthma back to school on the 1st of June? So multi-generational households and children with asthma, two big questions coming up.
Who wants to take that one?
Can we take it one at a time? The child with asthma, I think that's a relatively low risk, but is there somebody, Kamlesh?
Yeah, the risk with asthma is very low unless someone has severe asthma where they've needed steroids or something like that. But overall, the risk for asthma is low.
And the first question, Anthony.
Well, throughout this discussion, we have to emphasize we're always talking about balancing risks. You know, Kavita presented the evidence, very strong evidence about children, but because they're asymptomatic, it's less likely they're going to cough and splutter, and that's why we think transmission rates will be lower, but they won't be zero. Fiona said, what's the risk going to be like in September? Well, if things stay as they are, it will be less, but as you're absolutely right, it may be that we have another surge. Then there are the risks of education, and we've been in this report deeply concerned about children's widening disparities in educational opportunities, what we can do to fix that, about Wi-Fi access, play areas, the problem of hidden hunger. And the question on multi-generational households is really important. And that comes back to test, trace, and isolate. Because if you have a good isolation policy and you've tested, then you have to separate any case or contact in a household from somebody who's, say, for example, a grandmother who's over 70. And if that's not in place, and we're not confident that that's going to be in place by June the 1st, it might be by June the 15th. And that's why we're suggesting there should be a 2-week delay. But that's something we've got to get right.
In terms of what Anthony's mentioned, something else to add is that it will also depend on what kind of housing these people are living in, multi-generational housing. In some areas, you will have a very deprived locations where there isn't any areas for social distancing. It's very difficult for the grandparents to socially distance from the rest of the family, and especially if they are of certain ethnicities, Black minority ethnic populations have been disproportionately affected, then the risk is going to be much, much higher compared to where you've got a large house where you can easily socially distance.
It's very, very difficult for people. And I was wondering if anyone could imagine a situation where you create something like a heart risk monitor, where you put in data, you put in basically, as you say, your household, your circumstances, do I have type 1 diabetes, whatever. The R number in my local area is this, and then it comes out ping with a number which gives you some sense of your risk. Because without that, and people are really going to struggle to balance all these unknowns.
I mean, one of the factors that we've been worried about is the way that GPs are not being involved in the management of this entire issue. There's the person who should have the records for each of the people who come in to see them. I think I had Kamlesh indicating he'd like to come in.
This is just, Michael, I think it's a fantastic idea, developing some sort of a risk score or risk algorithm. And this is possible, but we can't get all the information that you mentioned. As is mentioned, we have the best database in the world, so we could create a risk score. But the kind of risks that we can create is things like that are readily available: age, ethnicity, chronic comorbidities, potentially your BMI. But then trying to get the data for the size of housing, the key workers, all those are very difficult to model. We need to get all of those data sets together. And currently we have data from the census, which is quite old, from 2011. So it's slightly out of date.
But broadly, would you agree that if you have no comorbidities, if you're under 40, if there are not other older members in the household, then your risk is low, and then beyond that it becomes much more complicated?
And absolutely. So Zubaida, did you want to come in?
I don't know if I could answer Michael's just last question, but one thing I wanted to say is we're talking quite a lot about risk, but we invited a lot of questions. Well, we invited questions from parents, teachers, and ordinary members of the public. And one thing that comes across very strongly, Michael, is that it's not just about risk for parents. There's also genuine fear, particularly from minority ethnic parents, about what will happen in their, as Kamlesh rightly pointed out, in their overcrowded and multi-generational households. Now, these parents are acutely aware of the figures that, depending on their ethnic group and depending on which part of the country they live in, whether they live in deprived areas or not, they are 2 to 4 times more likely to die from COVID-19. Now, these are very genuine fears. Now, one of the things that I want to emphasize is it's not just about risk, it's also about giving parents a choice if they have those fears. You're absolutely right, there should be some risk assessment, but I think ultimately parents should also be able to choose. But as my colleague Alison pointed out, choices are only based on the resources and the workforce available. And if the government expanded the school workforce so that those children and families that were vulnerable, that couldn't come into school, still had a decent education, was still given food, and parents still had the support and children were still getting pastoral care, or, as we've talked about, children could go to other places that were more safe, then it wouldn't be such a risky choice.
Okay, I think we have some research from Terry Wrigley. Do I see Terry Wrigley down there? Was something you wanted to say? I'm seeing Terry. Hello. Can you unmute yourself?
Can you hear me now?
I can.
Okay. I was asked to work with other education researchers to look at this great dilemma of the contradiction between infections and sickness on the one hand and the children's needs on the other, and to consider questions, very basic questions of how schools work. And one of the things that we came up with is that the government had placed an emphasis on 4 to 6-year-olds getting back into school. These are children who wouldn't be in school in many European countries anyway. And the suggestion that they could be placed in with physical distancing behind desks in a completely static situation, we considered that this was actually more damaging than them not being at school at all in many ways. So we've really got to consider, you know, the needs of the child. We discussed issues of disadvantage. Now, if we think about children living in flats, and currently very isolated, it may be more important, more of a priority immediately, or as soon as feasible, for a school to work with experienced play leaders, such as Scout volunteers and so on, to bring groups of children together out of doors with some suitable distancing, rather than sending them back to school. We also considered, I mean, there are special needs covers a multitude of issues, but there are some children who desperately need individual tutorial help. And of course, the families can't afford that. So that should become an issue, rather than simply thinking in blanket terms of a particular date to send all of this and that age group back to school. And all of this links to summer holiday schemes as well. One of our group raised the issue of the best summer ever schemes that ran last year. That could be rolled out, must be rolled out. Finally, you know, there's a specific issue of secondary schools. And thinking across Europe, our system is actually quite unusual in that children move about a lot from group to group to, you know, the math set B or the biology option and so on. And we need to start thinking about, as has already started to happen in Scotland, about a combined approach of attendance part-time and distance learning, which may minimize the amount of shuffling about of children between, you know, to mix up with multiple other children. So that, for example, you know, a science teacher could be working for several days or for each morning a week with one class, and other learning could come in through distance learning. This may be the sort of mixed economy that we need to consider for the autumn, and that might actually be educationally beneficial.
Thank you, Terry. Very interesting. Samira, more questions?
Absolutely. So a question that's come up a couple of times is, Toby Lincoln and Fiona Wright both raised it. Can you address any issues that are specific to nurseries in addition to those that they have in common with schools?
Anyone want to take up nurseries? Yes, Susan.
Well, really, in response to that, but also previous people who've spoken about the complexity of the situation, and the fact that schools and education at whatever level is not just about intellectual development, it's also about social and psychological development and social and psychological safety and welfare. And that's why I think that the ideas that Terry brought up and are in our consultation document about thinking in the widest possible way about how we can best serve the majority of our children. And it's a complex situation and it requires a complex response. It's not sufficient just to say these 3 years on this date. And we do know that viral transmission is significantly lower outdoors than indoors. We are coming into the summer season. And this is why we think for all age groups, there's a way in which, given that the resources we have and that the resources could be brought into play, that having more of an emphasis on summer camps, community exercises, using whatever facilities are outside internal school buildings could really help and tick a lot of boxes for helping our children get over the next few months, whilst at the same time being able to tailor some educational input for those who sadly have been left behind really in the increasing inequality there has been over these last few months.
Right, so the good news is that transmission outdoors seems to be much lower than indoors, and therefore allowing kids to meet up perhaps outdoors in a school structure would be a good way to go. Anthony, you wanted to say something. Can't hear you.
Just quickly, actually, Susan's made the point, but if you look at major spreading events, they've been in churches, in choirs, in households, in enclosed spaces, in tubes and the like. And so ventilation is important, not just because it stops major droplet spread, but there's increasing evidence that micro droplets are an issue and hang around in enclosed spaces. So ventilation, having windows open in classes, or better, outdoor classes, and that requires a lot of space if you're going to also have socially distancing. So that means parks and private school grounds, if they're available, football stadia, all the kinds of things we've talked about. We have to think very imaginatively here. And you can do a lot then with smaller groups, and also with moving around from class to class, you could arrange that in a much wider open space. So I think that's really interesting issues to tackle, which would dramatically lower the risk of transmission.
Fantastic. Kevin Courtney, are you there?
Yes, I am, Michael. Thank you very much. I'm Kevin Courtney. I'm the Joint General Secretary of the National Education Union. And thank you very much for the invitation to be part of this. Thank you for the work that you're doing. My union's been pressing for public science on these questions. We think this is a really good initiative. It's important to say that the vast majority of schools are open at the moment to small numbers of children from key worker families and from vulnerable children, and our members in supporting those children. And we do want to get to a wider opening of schools as soon as it's reasonably safe to do it. And we're not the scientists, so it's really welcome that you're thinking about that. We think it needs to be reasonably safe for pupils and their parents and grandparents, for staff and their families, and for the wider community. And we have, like I said, we're not the scientists, but we came up with 5 tests, the NEU's 5 tests. And I was just wondering whether you have looked at those and whether you could give a view of whether you think the tests that we've put there are reasonable scientifically. And in particular, there's one of the tests that we've put forward is that we think the number of cases needs to be lower in order that test and track and isolate, contact tracing can work to keep it low. So what do you think of that test? If you agree with it, when might it be met? I think you've given an answer for that. What do you think the chances are of that test being met by the 1st of June?
Right, who'd like to answer that?
Well, let me just take it on very quickly. I think the chances of this being ready on the 1st of June, the test, track and isolating program, are virtually nil at the moment. And we also consider that as a major test for any school to be reopened. Anyone like to take on the larger point? I see Carl.
Yeah, I just want to say that that analysis is completely endorsed by the modelling. If you were to get an effective track and trace protocol in place over the next month or two, by September, the prevalence of infection, in theory, should be sufficiently low that you may not even have to worry about social distancing at school. So, you know, I'm just sort of speaking against a slight meme that we're going to be in this situation for years to come, because there's always a latent rebound that's going to hit us in the face as soon as we relax any of these policies. That's not the only view. There is another view which is becoming increasingly prevalent, that there is a long-term risk as we slowly lose immunity and forget about the first wave of infections. But for the next few months, there's going to be a progressive decline in the prevalence of infection, to the extent it may well be by autumn there is just no need to have class sizes of 15. So I think a lot of the discussion and the difficult decisions really speak to what to do over the next few months, you know, until the early autumn. And much of that depends exquisitively on the ability to keep infections low via a track and trace policy. So until that is in place, all of that I have just said, has no meaning really.
Do we have Marvin here at all? I have a question from Marvin, but I don't see you on my screen. Marvin? Maybe Marvin will come later. Samira?
Yeah, so this question is quite interesting. Well, can you review the COVID-related inflammatory disease in children, especially the delay from infection at the onset of symptoms and to severe illness? I suppose especially in the view to schools, people are wondering how many cases might end up happening because of children go back to school. And he's also, or she's also asking how many cases have yet to be identified based on what we already do know about this.
Right, who wants to do that one? This new, right, Kemlish.
I think this is regarding the Kawasaki type syndrome that's come through. First of all, this is an extremely rare occurrence in children. I think we've had about 8 children who've had this in London. There's a case series that was reported. And unfortunately, one child, 14-year-old, had died. But it is extremely, extremely rare. Most children will get the mild disease if they get any symptoms at all. And the symptoms with this severe form, the Kawasaki type syndrome, is that you can tell that that child's going to be very, very ill. They get fever, they get this quite rash, which is throughout the body, either patches or punctate rashes. They get the symptoms of cold, glands are swollen, and they are quite ill very, very quickly. But I think one thing to say is it is very, very rare.
That's reassuring. Do we have Fiona Godley here from the BMJ? Hello, Fiona.
Hi, Michael. Thank you very much. And just if I might offer a slight correction, that this wonderful event comes in association with the BMJ, the British Medical Journal, not the BMA, in case there's any confusion. So my questions are, why is Ice Age modelling more trustworthy than the SAGE modelling that we're not seeing in any detail at the moment? What could SAGE itself do to restore trust? And what do you want the government to do now?
Right, 3 questions.
I can take the issue of trust, Michael, if I may. Really, the reason why we set up Independent SAGE is because we believe that transparency, as you can see in action right now, is a key part of putting scientific advice into government. When government ministers say we are following the science advice, the public have no means of knowing whether that is right unless the advice is put into the public domain. So getting back the trust of the public in science advice means having open discussions of this kind.
And why do you think, one of Fiona's questions, why do you think your models are better than their models, so to speak?
Let's go to Carl for that one.
Modesty aside, Carl.
What?
Modesty aside.
Modesty aside, yes. I would say trust in models. So let's just take a very dispassionate approach to that question, acknowledging that the trust in the modelers is a very different issue. But from my point of view, it's all in the evidence. So there's only one measure of the goodness of a model, and that's the likelihood that that model could have generated the data. And if it has a high evidence or a high what's called marginal likelihood, it's likely to give very much more veridical predictions in the future or generalized to new data. So the answer to the question, why do we think our models are better than conventional models? We've compared them using something called Bayesian model comparison, and our models are an order of magnitude more likely to explain the data than the current models that have been used. Having said that, this is an ongoing game. So we're all scientists. This is not a sort of adversarial approach. The whole point is to get all the models on the table and then evaluate their evidence in relation to the same data at hand. And that process, there are hundreds of people around trying to help in that process. I'm just going to highlight the efforts of the RAMP group, organized in conjunction with the Royal Society, whose job it is to triage literally thousands and thousands of modeling studies so that there can be some input to the SBIM and SAGE, who receives input from that group. And much of this game is really trying to provide an ontology of models, and more particularly have a focus on how to evaluate one model in relation to another. So, yeah, it's a great question, which people are trying to address at the moment.
I was going to say, Fiona, where do you sit? Where does the BMJ sit on this?
Well, I mean, we welcome the transparency, absolutely. I think it makes a huge difference, and this debate with input from the public and concerned members of the sort of professions is hugely helpful. So I absolutely applaud Ice Age, and I'm delighted it exists. I just feel it's a shame it has to exist. And I suppose my question about what SAGE could do, and what the government now needs to do, apart from following your recommendations, is, what could it do to really make us feel that it has a handle on this crisis, which I don't feel it does at the moment.
Anthony, you had your hand up.
Just very quickly on what the government could do. Sir Paul Nurse was on the Today programme this morning and was saying he felt there had been a really poor lack of communication. I do think now they should release all the SAGE documents and the SAGE minutes. I've always said I don't think we should be having a blame game. This is not a no blame. This should be a no blame audit of what's gone on, and we shouldn't pick on individuals. There have been system failures, but communicating the evidence and putting it out there would be very important, and they could do that straight away.
Dina, you had your hand up?
Yes,
Dina?
thanks, and thanks for the comments and questions, Fiona. As Dave and Anthony have said, this is not an alternative to SAGE. We recognise that science is not monolithic. We represent many different disciplines, and we recognise there's a tension between them, and there's uncertainty in science. And I think a key component of what we're doing is wanting to be able to display that uncertainty, what is known, what is unknown, and share that with the public, because that would allow the public and all of us to have a better appreciation of why policies need to be developed. One of the problems at the moment, of course, is that science is categorized as monolithic for the purposes of politicians to then be able to say something. And I think that diminishes the trust that the public has in science. And if we can contribute to that opening up and understanding, I think it's very good.
Great. Can I move to Marvin, who I can see now? Marvin, you with us? Right. Can we hear from you? You need to unblock the sound.
Yes. Can you hear me now?
Yes, I can.
Brilliant. So basically, I just wanted to ask a question. Obviously, with all the elite institutions like Cambridge University closed due to the pandemic until 2021, obviously you've got the NHS recognising the illnesses and mortality rate amongst the BAME community. Why is it that schools and the government have failed to act on this before forcing BAME teachers and children to return to school on the 1st of June?
Right. Who would like to answer that one?
I'm going to suggest Anthony,
okay.
And then Zubaida.
Anthony.
No, I think Kavita's better on this. She's the education.
Okay, fair enough.
Sorry, me?
Yeah.
Did you say? No, I think those are very important choices, but I will go back, Marvin, to, I don't know if you just joined us now or you heard what I said before, which is we have to think about whether the choices that we're giving to parents are real choices or actually enforced choices. And in the case of ethnic minority parents living in deprived areas, living in overcrowded houses and multi-generational houses, not all of them, but for those who do, I think there is a question for them about risk and heightened risk and the impact that it may have on their family. But it goes back to the choice that if the government once again created, and we've talked about this, other opportunities for learning for children outside of school, improved opportunities, using the resources and the facilities beyond school, whether it's football stadiums, whether it's whether it's converted warehouses or outside with big marquees. If the government had used those resources as well, then the risks substantially go down. And I think that's where parents have real choices, and that's where the risks are minimized. So once again, we've said this before and we'll say it again, the government needs to be a lot more creative and imaginative about the solutions that are out there for children's learning and to protect families who consider themselves more vulnerable.
Thank you. Samira, how's the response going down there?
Yeah, well, there's some questions coming up about local solutions. And I'm going to put two together, but I think you can separate them off. So one is from Matt Murphy. He's a parent in London of a 3 and 6-year-old whose nursery and school are due to open on the 1st of June. They're concerned about staff in the wider community as well as children. But he says new cases and the R number appear lower in London than elsewhere in England. Given this local data, is there a compelling case for reopenings in London with the 1st of June? And the idea that you might roll it out elsewhere later. And that's something that's come up from a few different people, rather than no one opening, expanding gradually based on local Rs.
Right, so London to open first. Anyone want to take that one on? Susan.
Well, just to say, in our discussion document, what we've really said is it needs to be on a case-by-case basis. So not even all of London, but really looking at each school and has the school met the criteria for being able to meet minimum standards of safety to staff and children for returning to school. So again, I think a blanket idea of all of London wouldn't necessarily be helpful. And I think local authorities who know the local communities, know the situations in schools, can work with all the stakeholders within each school to decide for them when is the balance going to be right for opening up the school to more children than are currently going to it.
Okay.
Michael, can I just give a follow-up that might be quite useful to get done now? So this is from Emily Courtin, who's at the London School of Tropical Hygiene and Tropical Medicine. How close are we to getting councils the information they need to make these kind of local decisions? And another one from Catherine Williams, who I think is a teacher. Where do we, as teachers, see this local data? How do we get the data? Who's privy to it?
Right, who's privy to the data? Anyone know? Alison Pollock. Alison, you need to unmute.
Okay, can you hear me?
Yes.
Well, this is a really good question, because this has been the key issue all along, is the lack of good local real-time data and the way in which the formal statutory notification system for infectious diseases has been bypassed. So a huge issue is that we are not capturing the data on the suspected cases and the cases in the community. And this means that we are really reliant on the hospital admissions and deaths, and that also affects the modelling. So the reason why we're also arguing that it's really important to have local track and trace is because it also needs to be linked back to local data collection. The GPs have been completely cut out of the system, and the test result, they can't even order tests, many of the GPs, and the test results are also not returning locally to the local public health departments. So there's an awful lot of work to do to make sure that we have the good data at a granular level so we can monitor the epidemic, do the track and trace locally, and then give the information and data and analysis out to the local community. And this is a huge issue that's linked to the fact that we don't have local contact tracing. I hope that answers your question.
So it comes back again and again to the data, and the data in a form that people can actually understand and use. John Richards. John Richards. Can you unmute? Yeah.
Is that better? Yeah, fabulous. Hi, I'm John Richards. I'm National Secretary for Education for Unison, the Education Support Workers Union, and we have about 240,000 members working in schools, and support staff, cleaners, caterers, school meals workers, midday supervisors, teaching assistants. Support staff are the forgotten part of the school workforce, and they've been largely overlooked by the government during this crisis. Like everyone, we want schools to open as soon as possible and when it's safe to do so. But my question is specifically about school support staff, and what assessment's been made of the risk to school support staff from the virus. The demographics of this group's over 50% of the workforce are noticeably different from teachers. Generally, they're older, they have a higher percentage of black staff, BAME, they come from more economically disadvantaged backgrounds. And so we know these groups are at higher risk. But so far, the government's only provided evidence relating to teachers. And I wondered if you've been able to look at the other 50% of the workforce.
Absolutely. Anyone want to comment on that? Any hands? Okay, it looks like, should we try Mike? Martin McKee. Martin, you'll have to unmute.
Yeah, and so very briefly, a very good point, and we do actually make it the point several times in our draft report. We highlight that this is a significant group of people who are in schools, and as you say, exactly what you say. So we do need to have that information, but we don't have the data to do that yet.
Right. Yes.
I think it goes back to also the fact that one of the things the government doesn't reinforce, and we are acutely aware of, is that schools don't exist in a social vacuum. You know, it isn't just about, as John says, about teachers and children. There's an enormous network of people that are supporting children in schools, and those are the cleaners, those are the support staff, but there are also people outside of schools and parents. You know, there's the issue of parents bringing primary school children to the gates, and it is an area that the government have been quite silent about. And I think John's absolutely right. We do need to consider that group, and we as Independent Sage have also tried to consult with that group and have argued that they should be consulted by the government.
Right, I'm going to have to move on because we've got quite a few more questions and we're running out of time. I believe we have Lucas O'Connor here. Is that right? Lucas, are you here? Hi.
Hello. So I'm Lucas and I'm from Farnham. I'm a year 10 student. I really want to go back to school because, I miss friends, teachers, everyone else. And I'm not really worried about the virus for myself, really, but I also know and understand about how we could catch it and we could pass on to other people. And so my question is, how will I be able to maintain social distancing at school when we have very small classrooms? And also, should I wear a mask when I'm in lessons to help protect my teachers and friends as well?
Right. So Lucas is keen to go back to school and to meet up with his friends and mates and things like that. And I guess what he wants to know is any guesses when he will be able to go back to school, and should he be wearing masks and things like that? Anyone got answers to that? Anyone like to let Lucas know? Okay, Kemlish.
I think we've discussed in detail about the kind of things that schools need to do, the assessments for pupils, the parents. And sorry, there's a noise outside. There's some cars passing by. I'm sorry about that. Okay, so I think we've already discussed in terms of the assessments that need to make to try and get the local data for infection rates, as well as the assessments of the school to make sure they're safe to go to, assessment of the staff. There needs to be some sort of an assessment framework for the staff, according to the previous speaker. We've got those for NHS staff. I don't see why we can't have them for the teachers and the workers there. And the children's assessment as well, we've said. In terms of masks, that's an interesting question because there is very little data out there, and the British Medical Journal's covered this extremely well regarding wearing masks in the public, and there's no data as far as I'm aware of wearing masks in school. Some countries such as France and China are making masks compulsory for children and the staff to wear, but we have very little data on that.
Right.
But having said that, it's not going to. it's not going to harm people wearing masks. And there are some countries that are making people wear cloth masks, which are readily available, as you know.
Okay, Dave.
I just want to come in and say my personal view is, based on what other countries are doing, that wherever possible, people should wear masks, and particularly somebody of your age. I think there's no question that the infectivity is going to fall. The question is by how much? And of course, that requires a detailed scientific analysis. But I think you are protecting others more than you're protecting yourself when you wear a mask. But that implies to me that actually, if I was your teacher, I would demand that everybody wear a mask. But this is my personal view.
Can I say something? First of all, thank you very much for your question. It's great to get the voice of school students into this conversation. Just to add to what Dave has said, masks are fine if they're worn properly. The problem is if people touch their masks or put their masks onto surfaces that are laden with viruses, then they can set up an additional transmission route, because then other people touch those surfaces. So long as people are wearing masks in the right way, and when they take them off, it either goes straight into a bin if it's disposable, or into hot soapy water, and people wash their hands afterwards, then that's fine. But like so many things, you have to balance up the different risks and look at actual human behavior in actual environments. So it really comes down to how people in schools would be wearing the masks. And as has been said, we don't have that data. Time will tell if that happens.
Okay, Dina.
Yeah, thanks. I'd really like to thank Lucas for that question. You clearly understand a fair bit about how it's transmitted, and you feel a responsibility for those around you, which is fantastic. And just to add to what others have said about, well, not necessarily about masks, but you should also, critically look at what your school is planning to do to ensure that you are safe and you protect others as well, and others are safe, and engage in that discussion, because every school, the precise details will have to be different according to the layout of the school, the facilities of the school, class sizes, the amount of outdoors, and so forth. So I just encourage you, Lucas, if at all you can, to engage very actively with your teachers, with other staff at the school, to help them as well come up with the best infection control structure. Thanks for your question.
Thank you, Lucas. Right, Samira.
One really interesting question. It's coming from Haroon Chowdhury, who works, I think, in the Office of the Children's Commissioner for England. Acknowledging a lot of what's been said about additional data is clearly needed on local rates of prevalence, infection, and R. You've been discussing the need for the government to enable this data to be gathered. How should people make informed decisions until that data is available?
That's a tricky one. Who would like to answer that one? What can you do in the face of uncertainty? They're looking uncertain. Hello. Yes, Gabriel. You were waving? Gabriel Scally.
Well, I think all that people can do in that situation is to work out themselves what they think is best for themselves and their families, and that they feel comfortable with. It's very important to stay in touch with what's happening and with what people are saying, and to look for authoritative sources of advice where you can find them from relevant organizations. And personally, I spend quite a bit of time looking at experience from abroad to see what people are doing elsewhere and how that's working out for them. But I think it comes down to a decision, and a collective decision, discussing with family what to do, and hopefully with a supportive community around you as well, even if it's a virtual community.
Zubaida.
I think I agree with Gabriel, but I think I feel much more empathy for the parent here. I don't think it's necessarily the parent's job to go out and find all this information. I think the whole point of the system is that both government and local stakeholders and schools and local authorities and public health authorities should all be helping parents to make those informed decisions. We can't expect parents to be experts like us, although it was incredibly impressive that the number of questions that we got that reflected how informed they are. These are very difficult choices, and for communities where they feel particularly vulnerable, the choice is either to risk infection or death or go to school, and that's not a real choice. So in order to give them a genuine choice, we need to give them genuine information, and I think that information needs to go to them rather than for them to seek it out.
Right. Do we have Harry Cutty here? I can't see you. Harry, hi.
Hello, Mike.
You have a question.
Yes, thank you very much. Before I start, can I just thank iSage for shining a light on the science, because that has been missing in the public domain. And as a head teacher, I'm a head teacher of a large comprehensive school, secondary in Southampton. We are triangulating as much information as we can to make a decision on the reopening of schools. We're looking at the public health information, the science and the data to make the best decisions possible. And of course, these are very important decisions for us. And it's important that we make the right decision now, because it's going to make an absolute difference. I'd also like to just thank the thousands of teachers, the thousands of students, and the thousands of parents that are engaging on a daily basis. Our schools still remain open. Of course, there are staff in schools, but there are also staff at home that are engaging with parents and students on a daily basis. So, you know, the reopening of schools is a really important piece of work that we're doing, and it's one that we don't underestimate, but it's got to be the safest time possible. Can I also just say to Lucas, I am really confident that your teachers will miss you as much as you miss them. So keep communicating with them. So my question, Michael, is this. There's been a lot of discussion around the R rate locally, and in the absence of an R rate locally, shouldn't the rate of infections locally determine when schools can most safely reopen more widely? And then shouldn't this information, shouldn't this rate be frequently tracked and published so that we create contingencies now, before we open, on what is the rate at which we then decide that we need either a partial or a full closure locally? And isn't it true that this, together with a robust test, track and trace model, is what's going to mitigate the greatest risk of a child or an adult coming into school with COVID-19? We can do everything in our power, and we are. Every school wants every child and every member of staff back. We miss each other greatly. And we're doing a lot to mitigate the risk in school. But what about outside of school?
Right, thank you very much, Harry. So David, presumably you would agree with all that, but the question is, how soon are we likely to see this sort of information? Can you unmute? David, you need to unmute.
I think Gabriel is the right person to answer this.
Okay, Gabriel.
Great question, Harry, and you are quite right. I think one size fits all just won't work in this situation, and we need to have information locally available to schools and to other kind of civil society institutions to know what's going on. And the only way we'll get that is through a really good case finding, testing, tracing system. And whether we're going to have that or not, I don't know. I'm not very optimistic at the moment that it's going to work particularly well in England. And otherwise, you are, as the Director General of WHO said, you're fighting a fire blindfolded. In fact, you don't even know that there's a fire going on. The ideal situation would be that a head teacher or any other concerned person in their community should be able to go online and see how many new cases have been identified in your area and make decisions accordingly. And one would expect, under those circumstances, local authorities would be deciding this town, this village, or this part of a city, well, we need to close things back down again if we're getting a real hotspot of cases. And I'm afraid I can't tell you when that information is going to be available. it'll not, I don't think it'll be terribly soon. And so we will have large scale information across the country. But I'm not quite optimistic that it'll be available anytime soon. Of course, if the numbers across the entire country go way down to really small numbers, that's a different matter. But almost inevitably, there will be hotspots occurring, and all that information and all that testing results has to be made available, and has to be made available to local people and local communities.
Thank you very much. We are running out of time now, though. There's one more question from Lewis Gist. Lewis Gist, are you here? Hello, Lewis. Hi,
Hello.
Lewis.
My name's Louis. I'm a Year 8 student from South Warwickshire. I'm concerned because I think our rising infections could possibly cause more deaths throughout the country. So will people going back to school cause another spike in infections?
Right. Who would like to take that one on from Lewis? Are we going to see spikes?
I suggest Christina.
Okay, Christina.
Thanks for the question, Louis. The evidence actually on how much schools contribute to transmission or increases in transmission is quite mixed. So some studies from Asia have suggested that it might have quite a big impact on R, so by about 0.3, but others have shown that it's actually one of the less effective social distancing measures that you can have. So we don't know yet, but that, I mean, we know we've talked about it a lot, but that is exactly why this test, trace and isolate at local level is so important. So you can stop outbreaks really quickly, and that will keep transmission down. And that's also why you kind of said it in the report, but if you have a partial or full school closure, if you spot a case, that's a sign that your policy is working, that you've got a really good, strong system in place to prevent things growing and going out of control.
Thank you. Lewis, are you looking forward to going back to school?
Well, I am, but it's just that I have to wake up really early in the morning, so I'm always really tired.
Okay, hopefully you will be back sooner rather than later when everything else is coming to place. I think it's probably time to close down now, and just to say a huge thanks to all the panelists, all the people who've asked questions. We're going to be collating your questions. They will form part of the information which will go forward to the government. And thank you all for watching and listening and partaking. And this is just the beginning of a very long conversation, which I think is
just
going on for some time.
before we wrap up, Michael, just before we wrap up, can we have Catherine from Times Education Supplement, because I know she's been waiting patiently.
Catherine.
Hold it, guys.
Hello, Catherine. Waiting patiently. Where are you, Catherine? I'm just peering down here.
Oh.
Can you see her anywhere?
It would appear that too late. So
too late.
We'll catch her after.
Another time. So thank you very much, Dave. Thank you very much, the whole team. And I think this has been really extraordinary. Well done, Samira. Some interesting questions there, yeah? Thanks all.
Thank you.
See you soon.
Thank you, everybody.
Bye.
Thank you. Bye.